that's why I hope you'll join me in welcoming to the stage.
In an election year like this one, the Texas legislature's decision to drastically reduce family planning funds has struck a nerve among abortion rights supporters.
Women's health care is being tossed around like a football. We're being treated like little raggedy dolls as they stand up there and they tell their various stories about why they shouldn't fund our programs.
Family planning didn't just emerge as a political lightning rod. It's a century-old battle that began in 1916 when a nurse named Margaret Sanger opened the country's first family planning clinic in New York City. At a time when women could not vote and contraception was illegal, the government promptly shut down Sanger's clinic. She went on to found Planned Parenthood, an organization that would push to legalize birth control. For Sanger, family planning was a deeply personal mission.
I came of a large family. My mother died young, 11 children. That made an impression on me as a child. I was a trained nurse, went among the people. I saw women who asked to have some means whereby they wouldn't have to have another pregnancy too early after the last child, the last abortion, which many of them had. So there's a number of things that are one after the other that really made you feel that you had to do something.
In 1965, the Supreme Court struck down all state laws prohibiting birth control use among married couples, but not everyone could access the pill. By 1968, Peggy Romberg, a wife and mother of two, pregnant with her third, began volunteering with Planned Parenthood Center of Austin, a clinic that raised private funds to offer family planning counseling. The experience exposed her to women of all ages and backgrounds.
I remember the face-to-face, one-on-one interviews with women, and my big awakening was that their lives weren't like mine. They didn't have a supportive husband, they didn't have supportive families, they didn't have health care.
In recent years, Democrats have carried the torch for government-subsidized family planning for hundreds of thousands of low-income women in Texas. But it wasn't always a partisan effort. In the late 1960s, George H.W. Bush, then a Republican congressman from Texas, pushed for increased federal funding for family planning. He argued it would help fight poverty and welfare costs and eliminate the needless suffering of unwanted children and overburdened parents. The future president crafted legislation that created a public health program called Title X. President Richard Nixon signed the bill into law in 1970. Today, Title X still stands as the federal government's only dedicated source of funding for family planning. In 1980, Peggy Romberg took on a new role as the first executive director and CEO of the Women's Health and Family Planning Association of Texas, a position she held for 26 years.
And when I came to that job, one of the things that made me really happy was that it worked for all women's health care, the whole spectrum.
Romberg and women's health advocates statewide lobbied to receive federal funds, not just from Title X, but also from Titles 5 and 20, maternal and social services block grants that flow to the states from Washington. In the coming years, the scope of federally funded services expanded. Under both Republican and Democratic presidencies, government funding for Texas increased from about $12 million a year in 1980 to more than $50 million a year in 2011.
Most people sitting out there think, well, it's packages of birth control pills or an IUD or a condom or something like that to prevent pregnancy. But family planning services, due to federal guidelines, became essentially their well-woman checkup for all these women. Health screenings for anemia, hypertension, diabetes, sexually transmitted infections, blood pressure, pap smears for cancer, breast exam for cancer, early detection, and then referrals if we found anything wrong. We certainly never even came close to meeting 100% of the need. We always had a huge unmet need, but more and more women, as we built that budget, more and more women had access.
Studies have shown that taxpayers save more than $3 for every $1 invested in family planning. In 2005, a bipartisan effort in the Texas legislature led to the creation of the Medicaid Women's Health Program, a service that added about $35 million a year to family planning funds in Texas, with 90% of the tab picked up by the federal government. The program has since become a safety net for 130,000 Texas women every year who are not pregnant and cannot otherwise qualify for Medicaid. Republican State Senator Jeff Wentworth has long been a proponent of family planning funding as a fiscally conservative position.
For those people that want to plan their family and have children only when they're prepared emotionally, financially for it, they're going to have fewer kids. For people that have unplanned families, they're going to have more kids, obviously, by definition, than they intended, and it's going to be more difficult, more challenging, more economically devastating to those families that have more kids. So it is a prudent fiscal thing to do to engage and fund family planning.
Wentworth's position on this issue makes him a rarity in his party and a target for anti-abortion groups every time he runs for re-election.
There is, I believe, a fear among some that the Republican primary is where these decisions are made, and more the anti-choice folks are beginning to be politically active and dominant.
Other factions of the GOP disagree. Texas Conservative Coalition Research Institute Executive Director John Coliandro says it may be time to redefine the role of government in women's health.
There is a role for government in women's health as it pertains to things like screening for cancers and so forth. But if you're talking about providing contraceptives and abortion, at some point you have to ask the question, and it's a very legitimate question, where does personal responsibility enter this equation?
The issue has actually been lingering at the surface for years. By the time Bush Sr. entered his first year in the White House, the term family planning had started to become synonymous with abortion.
There are many issues, and abortion divides. We have room in our party for people that feel one way, pro-life or pro-choice. Democratic Party the same way. I think everyone knows that this is an issue that divides.
Before retiring in 2006, Romberg began to see signs that family planning was being targeted.
Now, historically, the anti-choice factions in the lobby and in the legislature, for the most part, left family planning alone. They had bills that they had introduced dealing directly with abortion and counseling and referral and stuff like that, but they didn't go after the money until in the last several years, where we've seen real attacks on family planning.
Though state and federal rules prohibit spending taxpayer money on abortions, opponents of the practice have begun to view family planning money as a means for clinics to free up dollars that can prop up their abortion services. Their primary target is Planned Parenthood.
It is hard for people to believe that an organization that is so interested in ending the life of an unborn child somehow is going to have the interest at heart of what women really want.
Jonathan Sines is an attorney with the Liberty Institute in Austin, a conservative Christian group that opposes abortion. He questions the role of government in family planning, and any claims that it's effective.
Is it a benefit to women? Are they less likely to get pregnant? And so what it seems as if the government is encouraging more sexual activity. And because the very nature of the fact that they're encouraging more sexual activity by paying for contraceptions is resulting in them having more sexual activity and putting themselves in a position where they're more likely to get pregnant, because we know that these contraceptive methods don't work 100% of the time.
In 2011, a wave of socially conservative Republican lawmakers swept into the State House. They promised to rein in state spending, which gave them an opportunity to try to cripple Planned Parenthood, a big beneficiary of government reimbursements for birth control, STD testing, and cancer screenings. Lawmakers diverted 2/3 of family planning funding to other causes, ending services to an estimated 150,000 women. They also created a tiered priority funding system. Dozens of specialty reproductive health providers, longtime partners with the state, lost their contracts. In recent months, Governor Rick Perry has announced the state will take over the Medicaid Women's Health Program and forego federal funding in order to exclude Planned Parenthood affiliates from participating. Planned Parenthood is the single biggest health care provider. With the lawsuit pending, though, those clinics remain in the program. Federal funding expires by year's end, and while Perry has promised to keep the program going, he has not said how it will be paid for. The decision has enraged Democrats and abortion rights activists, who point out the program's bipartisan roots.
A program that, Peggy, you remember, was started in 2007 under George W.
But Coliandro says America has changed. Just as some Planned Parenthood clinics expanded to include abortion services after the Supreme Court's Roe v. Wade decision legalized the procedure in 1973, he says the need for government investment in family planning must also be re-examined, and he argues women's health should be divided between life-threatening and preventive services.
If you decide to be intimate with a person and that leads to pregnancy, that is your responsibility. There are lots of people who get leukemia, and that's not by choice. That's not by any decision they've made. That is pure an accident of genetics, and it's sad, and they need help. But when you willfully make decisions that have serious consequences, that require you to have responsibility, I'm not sure that the government has a role in helping you work through that.
Romberg and advocates like her hope the pendulum swings back the other way. But as long as women's health is entangled in the war against abortion, the role of government in funding family planning will remain small. Reporting in Austin, this is Ton Tan with the Texas Tribune.